Well, hello, everyone, and thank you for attending our COVID-19 Town Hall Unanswered Questions live stream. My name is Holly Foxworth. I'm a registered nurse with Axiom Medical, and I'm also joined by Axiom's Chief Medical Officer, Dr. Scott Cherry. As most of you know, Axiom has been hosting weekly COVID-19 webcast series on a variety of different workplace-specific topics. And in Thursday's Pandemic Adaptation Safely Back to Work, you guys asked some really great questions that we weren't able to cover in the broadcast. So we wanted to come back and ensure that you had the information via live stream. Before we get to those, I would like to say hello to our COVID-19 warrior who's been with us since day one, committed to helping employers really navigate this pandemic from every angle. So welcome to the show, Dr. Cherry.
Thanks for having me.
Yeah, we truly appreciate all the hard work that you've been doing. So please tell us a little bit about your background.
Yes, hi, I'm Axiom Medical's Chief Medical Officer. I'm a occupational environmental medicine physician. I also did a residency in preventive medicine and public health. I'm a fellow of the Occupational Environmental Medicine College. And really before where I started my medical career was supporting military operations from a medical perspective in the U.S. Army. And once I left the military, I was supporting corporate and industrial operations that, hold on one second, I'm getting a call from our operations center, sorry about that. When I left the military, I was supporting corporate operations in oil and gas and petrochemicals for a number of years, and then I've been with Axiom subsequent to that.
Great. We'll talk about a week to have addressed the subject of public health. I think we had now, like 31 states that have kicked off their phase one of restarting the economy and easing the restrictions. Is that what you understand as well?
Yes, that's how I understand it.
Yeah, so the information that you provided around the importance of education and then also policy development and ongoing surveillance, I mean, it's just such a relevant conversation of what's going on. Obviously, what's occurring in the public front directly correlates to some of those challenges that employers are having to address in the workplace there. So speaking of which, hey, I did want to cover, I've had a number of you that have reached out and asked, how can I have my COVID-19 questions answered by the experts? And so that process is really easy. If you'll email those questions to coronavirus@axiomllc.com, I can promise you that we will tackle those. So everything from health to HR to what to expect in the future, let us know what's on your mind and we'll get those addressed for you. Well, Dr. Cherry, what do you say we go ahead and jump into some testing questions at this point? Are you ready for that?
Sure, looking forward to it.
All right, good. Well, the first one that we had, Lisa mentioned that she's actually with a medical device company who's starting to see some of the hospitals require negative COVID-19 tests to gain access to facilities. So given that testing has had such a small period of validity there, she's wondering how often that testing can and will be implemented and required to access some hospitals.
Yeah, so if we look at the current CDC guidance for those that have tested positive or have symptom or presumed positive, so if they just have symptoms but haven't gotten a test, there's two tracks by which you can return to work. There's a symptomatic track and then there's a testing protocol track. And so this question addresses the testing protocol track, which is you need two PCR or the viral swab test in the mouth or nasal cavity. And so you need actually two negative tests 24 hours apart. And so, you know, there's limitations to this approach. One, testing isn't widely available. It's probably much more available than it was previous to now. And every day there's an evolution of how testing is becoming more available. So obviously there's, you know, that limitation. Let's see, what do you see about how often testing can and will be really implemented and required to access the hospital? So I think that in the hospital setting, because there's a concern about it's a high-risk group and it's also treating high-risk population, the patients coming in, I think the hospitals will be requiring, for the most part, the testing protocol. And so there are some inherent weaknesses of the PCR test where there's a relatively high false negative rate. And, you know, so, you know, again, what we look at is probably my best recommendation would be to have a two-pronged approach. If your business or your health system is requiring testing protocols, in addition, you also want to have syndromic surveillance. So syndromic surveillance is really symptoms, and so you want the test to be negative, but you also don't want to have symptoms consistent with COVID-19 or any other respiratory disease. So I think that would be the best approach.
Okay. And so do you think that I've reached out kind of in some of my contacts as well, and it looks like that maybe some have rolled that out to some degree, but others still may be struggling with that. Do you think that that will be kind of the standard moving forward for gaining access to some of these hospitals?
I think the testing protocol will be more utilized if the tests are more available. And I also think that as antibody testing becomes more available, that can lead to more insight into those that have been exposed and potentially immune.
Asked antibody testing and employment decisions. She says that we've heard of some companies testing their entire workforce for COVID-19 and antibody testing. So what employment decisions are based on these tests with the current inconclusive science?
Yeah, that's a great question. And so, again, all these tests are not FDA approved. They're authorized under the Emergency Use Act, and so they're legal to prescribe and implement. However, there's huge caveats right on the labels of these tests that say the information should not be the sole reason to diagnose or to make decisions. And so we're really in a tough place right now where there's been a huge push to get more tests out. However, especially in those who are not symptomatic or do not meet a clinical criteria for testing, it's really hard to infer those results clinically and then even operationally in an employment or a population health setting. And so, for antibody testing specifically, you could infer it based on other viral antibodies that if you do have the IgG antibody, that you would be presumed to be have been previously exposed and then probably have immunity or potentially have immunity. And so that's probably the best I can state from a programmatic perspective at this point.
Okay. And then Mike was wanting to know if you've heard of any issues of employers requiring a self-administered temp check at home prior to coming to work.
Have I heard any issues with employers requiring? I don't believe so. If the question's alluding to kind of the legalities of it, I know our chief legal officer has been on here previous, and also our CEO, and we've all discussed kind of the evolution of allowing, or is there the actual ability to allow for or requiring temperature testing before coming on? But I believe at this point there's really no legal issues per se. I mean, check with your own HR department just to make sure there's not a state or local law that's affecting you. But in general, most of our clients are requiring this without any issues across the U.S.
Well, and with that gives an opportunity to kind of self-assess the symptoms in the very beginning so that you're not actually bringing that to the workplace. Isn't that the understanding as well?
Exactly. Obviously, testing is on the forefront, but we should not forget the good old-fashioned medicine where docs, before technology, went on history, physical, looking at your symptoms, and so really, regardless of your test status, if you're feverish and coughing and have kind of that typical sick picture, you should by no means coming into the workforce or really into the public.
Excellent points. Well, let's shift gears now and talk a little about OSHA for a moment. We talked about last week the COVID-19 Every Worker Protection. And so that has many people looking and kind of anticipating what OSHA's next move is going to be. So Tim was wondering whether this is actually going to go beyond what was initially put out in OSHA's guidance on preparing workplaces for COVID-19.
Yeah, I think it will if this legislation is passed or new legislation is, from my understanding, the chances of a bill being, it's a process basically, the legislative process. But I think there's good footing that there will be some type of legislation passed that's going to push OSHA to issue a more formal or kind of a traditional standard. Right now, there's just this emergency temporary standard, and I think it will address it will bring in the employer's obligation to handle personal medical illness much more broadly than what has previously been kind of the understanding. So there's the previous OSHA rule was the flu and common cold were not considered work related, and then there was some exceptions for H1N1, and then some other maybe interesting pandemics that had hit. But I think nowadays, based on the huge how this pandemic has really affected business operations and our way of life, there may be this push to making it much more broadly required. So having an infectious disease exposure control plan, which is usually the standard in hospital settings, research settings for infectious diseases, may now be the standard for many industries that really had never had to deal with this before.
Okay. And then Darla is asking about dates for meeting OSHA requirements. I assume that she's referring to the emergency temporary standard.
Yes, and I think we might have actually touched on that, if I remember correctly. And I actually remember asking your help on this, Holly, because I know you're, aside from being a moderator, which we really appreciate, you have a wealth of knowledge yourself, and you're up to date on these as well. So was it 7 or 10 days from that date the emergency temporary standard was issued?
Yeah, I think the initial literature that came out had said 7 days, but then I was looking at the bill more closely, and I think it said that they were going to give 14 days for the states to kind of roll some of that out. So Chuck may be able to give us a little bit more guidance this next week when we kind of get into these some of the risk mitigation and things like that. But we can go over it a little bit more in detail then.
One thing, just real quickly, one thing I can state is this timeline is so. It's a very short timeline when you talk about OSHA. Usually when they change a standard or issue a new standard, you're talking about months or years to implement. I think most recently was the silica standard a year or two ago, and they were basically lowering the threshold for which we call a permissive exposure limit, which was going to bring a lot more of the workforce under that standard. But I believe they gave the industry, at least months, maybe even a year to comply with this. So when you talk about a week or 2 weeks, like for me, it's all the same. That's super quick. You have to be very nimble now.
Right. I agree completely. Well, then moving on to mask, Scott has some concerns with states that are requiring mask or facial coverings. He feels that they may give some sense of a false security and some additional risk. So he's wondering if you have any thoughts on handling this from a business standpoint, or if the new OSHA emergency standard will address this.
I think that will probably be a big part of the legislative process. And then even once that bill is passed, OSHA is going to have to really weigh the pros and cons based on the science and evidence of face mask. And I think there's not a lot of evidence or literature in the medical evidence, how effective these face masks are in limiting the spread of the disease. So hopefully we will get more information on studies that are being conducted that would help us give us the best scientific information to make these policy decisions. And so getting back to the first part of the question, concerned about requiring workplaces, false could add additional risk that could be worse. So, this is something that, if you're required by your state or local municipality, it makes it almost easier in some way because you don't have a choice. But if you do have a choice, I would definitely look at, does wearing this mask change your safety or your safety profile or your processes to where potentially the risk and benefit is skewed. you should still maintain social distancing regardless of wearing a face mask. And so I can appreciate that concern about the face mask giving a false sense of security. And so I think also social distancing at that 6 feet is still, as we get more medical evidence about how effective that is, we can start making more informed decisions from a data perspective. And so at this point, really trying to embrace both of those safety measures is the best case that we know at this point.
Sure, absolutely. And then Haley brought up an issue that we've seen a lot of interest in. I think we actually even covered some of this last week, the issue of limited supply and access to supply. But she mentions hearing about washable masks in Singapore and is wondering if you've heard any recommendations for how that could be utilized in the workplace.
I have seen or heard about washable masks. I have not seen any of our clients utilize them, and so I don't have any firsthand knowledge of this. Probably the best thing I can speak to is I know healthcare systems were looking at washing even N95s at the end of shift, but I really don't know much more. Have you seen anything, Holly, within your network?
Yeah, I mean, I think that they were using a hydrogen type of solution, but I'd have to do more research in it. But I'm not aware of any of our clients, as you mentioned, that have been utilizing that strategy.
Yeah.
But it definitely will be something to look at. And hopefully, like before, the supply will come about and everybody will have greater access. So I think that hopefully that'll be where we put our focus. And then let's see, in terms of return to work, David says that supporting organizations are suggesting a return to work in phases. And so he's asking, could you elaborate a little bit more on how to proceed with that strategy?
Yeah, I may not have the phases memorized, and so I'll probably need to look up kind of just as a reminder. I just don't have those committed to memory. Holly, would you happen to have those?
I think you may be referring to just kind of how this is all going to work out. So, maybe in the initial phases with continuing telework as much as possible, and then, advancing that forward. Is that what you kind of had in mind?
Oh, yeah. And so, I think what's crucial in phase 2 is kind of making sure you protect the vulnerable populations. And so really that's an obligation from the employer that I perceive as you have HR policies that provide education to your workforce that say, hey, these are the high risk categories, and you provide that information broadly to your workforce and say, discuss this information with your personal medical physician and determine if you belong in these high-risk groups, and then you can kind of engage in that reasonable accommodation process by which the Americans with Disability Act requires, where they may need masks, they may need to potentially be longer in the work from home phase than those who are not considered a vulnerable population. So I know phase 2 is a very important one. I believe another huge component of the phases looks at if there's a resurgence of cases in your community or in your workforce. So you want to be able to monitor your absence rates and things like that to get a sense by which how your workforce is responding to a return to work protocol.
Sure. And Mark had brought up some great points whenever he had spoken about this before about, really looking at your individual circumstance and not bringing everybody back into the workforce at the same time, about really spacing that out and taking into account the limitations that you have and resources there for social distancing and some of the other strategies.
Yeah.
Definitely. Okay, and then our final question actually relates to quarantine, or as we commonly refer to it as isolation. Catherine says that one of the questions that she gets is, my spouse or family works with someone who is diagnosed with COVID-19, and neither my spouse or I have symptoms, but they want to know if they should self-quarantine to be safe. So her question to you then is asking, at what point is preventative self-quarantine? When would that be advised?
Sure. And so let me just read the first part again. So really the rule, the guiding principle for when you should quarantine is what we call close contacts to someone who either has been diagnosed or is a presumed COVID-19 case. So if you've been around someone with a contagious disease, so in this case COVID-19, you want to determine if you've been in what we call close contacts. So the CDC defines close contacts in this public health emergency as within 6 feet, and then they have kind of a range of time from 10 minutes to greater than 30 minutes. So, if you've spent some, at least 10 minutes or so with someone within 6 feet, and they, again, were a positive or presumed case of COVID-19, that's when you should self-quarantine.
Okay. Well, I think that's going to do it for our questions. Dr. Cherry, is there anything else that you would like to add?
Let's see. The CDC guidance continues to evolve the last few days. There's been significant change on the symptomatic or positive or presumed and positive COVID-19 return to work guidance. So I'll just speak to that briefly. Originally, this was, really probably 6 weeks ago now, or maybe longer. The original guidance was 24 hours symptoms free, you can return to work. And then some new guidance came out that we've been utilizing for the last probably 4 or 5 weeks, where you need to be symptom free for 72 hours, and symptoms had to have at least 7 days had to have passed before returning to work. And now the CDC, on Friday, they changed it for healthcare workers, where you had to be 10 days had to have passed before you could return to work from your symptoms beginning. And then just today, they've shifted it to all work groups. And so I would just say, in your business, it's very important to be aware of these changes, because it can quickly shift how you can defend continuity of operations if you're not up to date. And so if you don't have the resources to be able to stay up to date on these what seems to be quite evolving regulations, please engage with a medical professional service that can help you really empower your business. The worst thing that you would want is to have your operations shut down by the local public health authorities.
Great points, absolutely. Well, Dr. Cherry, I appreciate you joining us today. Just a quick few mentions here. If you haven't already signed up, we have another webinar that we're going to be hosting on Thursday at 1:00 p.m. Central, and that's going to be with our Chief Legal and HR Officer, Chuck Hable, regarding risk mitigation and the changing landscape of employer liability and responsibility. Chuck also wrote an excellent white paper, The World After COVID-19. You guys can download that free from our website. And don't forget to send us the town hall questions to coronavirus@axiomllc.com. Finally, should you have any questions regarding coronavirus rapid response program or the new Check Into Work app, be sure and reach out to us. So again, thank you for joining us, and we look forward to seeing you Thursday at the webinar. Stay safe.